Dr. Runkolo is a clinical pharmacist and public health expert, and she joins us on the program. Glad you could join us today.
Thank you very much.
All right. First, we'd like to ask if you're happy that the public hearing is taking place on what has been called the controversial infectious diseases bill.
Yes, I'm very happy that a public hearing is taking place. It's an avenue for every stakeholders to contribute their own thinking so that we can come out with something that is robust and will work for our community and Nigeria.
Did you have any problems with some parts of the bill? And do you think that there needs to be a balance between this public health or public health emergency and human rights?
Yes, there must be a balance. In as much as we are looking at the public good, we must also consider people's human rights. It must not be abused. So anything that will protect the whole community is welcome. At the same time, you must not trash human rights as well.
Let's look at the case management strategy to COVID-19. We've been told that a negative COVID-19 test is no longer required to discharge a COVID-19 patient. Explain to us what that means. When what we know we used to hear was that someone turns negative twice and the person is being discharged.
Well, as we all know, COVID-19 is a novel infection, and the researches are ongoing every day all over the world. So recent research shows that 10 days post-infection, the virus is not able to infect somebody else. That is, you are not able to infect or pass on the infection to somebody else. So 10 to 14 days after infection, without any negative testing done or any test done, we can say that you are clear and you are not able to transmit to your neighbors and your family. You're safe to be with your family.
But how reliable is that data?
Well, all researches have shown that even when it was cultured in cell culture, PCR, it was not able to infect people. So I think it's quite reliable, though we might still need to do more work on that, which means every patient that is discharged, there might still be a need to follow them up and see how safe that is.
So when Lagos talked about it, they also mentioned the home care strategy, which they'll be using. And some people call this good news because of the availability, limited spaces of bed available and treatment center. So looking at home care, how can that work for Lagos in this case?
Wow, Lagos is the epicenter for COVID-19. And the truth of the matter is that the treatment centers have been overwhelmed. So the earlier we commence the home care, the better for us. However, there's a need for caution. And that is the fact that we can only manage patients that are asymptomatic and or showing mild symptoms at home. And there's also need to follow up properly them. Like it was mentioned during the hearing that NCDC has limited human resources. This is a time for us to step in as community pharmacies, as primary health centers, to monitor such patients. So what I expect is that for every patient that is going to be managed from home, they should be attached to a health facility, primary, secondary, that is close to them. There are also health practitioners, community pharmacies that will be readily, that will follow up this patient on a daily basis, check their temperature, check their oxygen saturations, check their general well-being, their mental health, and communicate to a desk office at the NCDC or Lagos State NCDC Center so that they can properly monitor those patients. Also, the environment is very important because they need to really sanitize the environment. So there's a need to really work hand in hand with the primary health centers. They have the environmentalists, we have the nurses, we have the extension health workers. These people should be put in places to help out.
So it's a lot of healthcare, frontline workers involved. Do we have that manpower, and how do you think they're doing so far in the fight?
Yes, at the tertiary level, I think we are trying our best, but we are getting overwhelmed. That is the need. There is a need for us now to step down to the primary health care level to help and monitor this patient. We have people that are trained, and I know there have been about 200 people, health workers that are trained at that primary level. They are going to step down the trainings to the local government, and because these people are closer to the community, they might be able to do a fantastic job of that.
All right. We'd like to appreciate your time, Dr. Runkolo, clinical pharmacist, public health expert. Thank you for joining us on the program.
You're welcome.